name is Karim. I'm a clinical pharmacy student, going to fourth year undergraduate. I'm from Cairo, Egypt. I came all the way here to work on a project HIV. Right now I'm going to talk about viral load. Viral load is basically the severity of the virus in the on the disease. Is the severity of the virus caused by the disease. And the severity of the disease caused by virus. It's calculated by the measuring of the number of viruses in the body. It's measured, for example, not directly to the virus. You cannot measure the virus, but for example, using HIV, like specifically for HIV, you can use the nucleic acid tests, like for example CPR, PCR, polymer chain reactions. This actually like targets the genetic material. So right now you cannot like count the number of viruses, but you can count the number of CD4 cells. CD4 cells are white blood cells. You can count the number of white CD4 cells. So when the CD4 cells drops, a specific number means the virus, the HIV is increasing. So if the CD4 increases, the HIV number decreases. So you calculate it indirectly by calculating the number of CD4, not directly the virus. That's basically virus load.
If you are not taking regular medicine, if you are not taking the regular medicine,
yes,
and you want to just maintain your viral load, or sugar?
No, of course not. You have to, you cannot maintain the viral load because you're not taking anything to stop the replication or the progression of the HIV virus. So it will keep progressing. So the viral load will actually increase, like viruses will actually, the HIV will actually progress and replicate, so it will increase in the body.
What other thing required with medicine?
Primarily like moral support from the community, as without moral support it will cause depression and they will feel that they're not needed by the community. So they will just because psychologically psychology plays a large role in disease progression. For example, one is not happy about himself, is not accepted by the community, with his family. So actually depression will actually make the progression, and he will stop taking the medicine. So what's the use? Like nobody in the community accepts him as a human being, as a normal, as an equal. So it actually is, some people may think there's no use of taking medicine or even getting treatment for the HIV. So it's basically the same idea.
How much diet is required for this medicine?
How much what?
How much good diet, balanced diet is required with the medication?
Of course, you don't eat fried, I actually don't know the diet exactly, but of course you need to eat healthy food. The healthy food which actually, we don't eat food that interacts with the drugs you take for the treatment of the HIV. Because most of the drugs, like these highly specific drugs like for HIV and stuff like that, actually interacts with some of the food. So you need to eat healthy food that will actually support the drug to make maximum effect, maximum therapeutic effect for the HIV.
What fruits has been help for the medicine and help for the control of the viral load?
Of course, something that will decrease the of course not to eat something that will increase the replication of the HIV. For example, you need to eat vegetables, fruits, stuff like that. But if you eat I'm not sure, but if you eat, for example, fried foods, junk food, this unhealthy food, or food from the streets, will actually increase the other number of viruses. For example, you have hepatitis. For example, if you get hepatitis B from the food, hepatitis A. B, or I'm not sure. Okay, but if you get hepatitis from the street, it will actually worsen your immune system along with the HIV. So it depends on the food. You need to eat food that will not get you infected or compromised through other diseases or other viruses. So in order to maintain your immune system.
Correct. Thank you.
You're welcome, sir.